Hello everyone, I am Vaibhav Bakale. I am going to discuss on the topic Investigator Undertaker. Investigator Undertaking, also known as the Investigator Agreement or Investigator Pledge. Investigator Undertaker is a crucial document in a clinical research, particularly in the clinical trial involving the human subjects. So, this document outlines the responsibility and the commitments of the principal investigator or a site investigator who is conducting the clinical trial. The primary purpose of the investigator undertaking is to ensure that the investigator understands and agrees to abide by ethical, regulatory, and the scientific standards when conducting a clinical trial. So this document helps maintain the integrity of the trial, protect the rights and the safety of the trial participants, and ensure compliance with the applicable laws and the regulations. Components of the investigator undertaken. First is the study information. Investigator undertaking begins by the providing details about the clinical trial, including its title, protocol number, and a brief description about the study. Then the IR investigator responsibilities. Investigator responsibility outlines the specific responsibility and the duties of the investigator, which is typically include the conducting the study in accordance with the approved protocol, then ensuring the safety as and well-being of trial participants, obtaining informed consent form, then complying with the all applicable laws, regulations, and the guidelines, then accurate and timely record of the study data, then reporting adverse event and the study and the other safety concern, maintaining source documents and records. Then third one is the ethical consideration. So the document after emphasizes the importance of adhering to ethical principles such as respect for the autonomy, beneficence, and the justice when conducting research involving human subjects. Then the fourth point is the regulatory compliance. Investigators are required to agree to comply with all the relevant regulatory requirements, which may include the good clinical practice, means the GCP guidelines, the Declaration of Helsinki, and the local laws and the regulations. Then the confidentiality. So the investigator undertaking usually include a clause on a confidentiality, especially that the investigator should protect the confidentiality of the study related information, including participant data. Then the financial disclosure. So investigator may be required to disclose any financial interest or a conflict of the interest that could potentially affect the integrity or the objectivity of the study. Then the audits and the inspection. Investigator agree to allow regulatory authorities and the sponsor to conduct audits and the inspection to ensure that the compliance with the terms of the undertaking. Then the signature, last one. The document concludes with spaces for the investigator's signature, date, and sometimes the signature of the witness. Then the importance of the investigator undertaker. So it established a legally binding agreement between the investigator and the study sponsor or a regulatory authority. It outlining the investigator commitment to the conducting the trial according to the ethical and regulatory standards. Then it helps to ensure that investigators are aware of their responsibility and the obligations, reducing the risk of protocol deviations, then data insurances or ethical violations. It provides a basis for holding investigator accountable for their action during the course of the clinical trial, and it enhance transparency and trust among the all stakeholders involved in the clinical trial, including participants, sponsor, then regulatory agencies, and the scientific community. So this is about the regulatory binders. Hope you all like my video. Thank you.